Today we'll be going through the drug Perampanel. Perampanel, also known as Fycompa, belongs to a class of drugs called anticonvulsants. Anticonvulsants work by altering electrical activity in neurons by affecting ion channels in the cell membrane to prevent and treat seizures. Perampanel is indicated for partial onset seizures with or without generalized seizures in patients 4 years and above, along with primary generalized tonic-clonic seizures in patients 7 years and above with idiopathic generalized epilepsy. The pharmacokinetics of Perampanel. Perampanel has a rapid and complete absorption rate, with the median peak plasma concentration varying between 0.5 to 2.5 hours when fasting and delayed 2 to 3 hours when taken with food. Mean peak concentration is reached at approximately 1 hour and drops 40% when taken with food. However, it is important to understand that the absorption strength is not affected by food intake. Perampanel is 95 to 96% protein bound in the concentration range of 20 nanograms per ml to 2000 nanograms per ml. The main binding proteins being albumin and alpha-1 acid glycoprotein. It is metabolized via primary oxidation and sequential glucuronidation. The half-life ranges from 52 to 129 hours, the excretory organ being the kidney. This is at 30 to 70% metabolites found in both urine and feces, with 22% found in urine and 48% found in feces. In a healthy patient, Perampanel has a clearance rate of 12 mL per minute. What are the pharmacodynamics of Perampanel? Perampanel is the first drug specifically designed to modulate AMPA receptors of glutamatergic transmission. Perampanel acts as a non-competitive AMPA receptor antagonist. These receptor antagonists are not displayed by glutamate because of their different binding sites. Glutamate is one of the major excitatory amino acids involved in neural processes. AMPA receptors are the most abundant ionotropic glutamate receptors in humans and appear to have a critical role in the generation and spread of epileptic seizures. Although the exact epileptic mechanism of Perampanel is not known, studies do suggest that the AMPA receptor antagonism can lead to reduced overstimulation and anticonvulsant effects. It is assumed that human hippocampal and neocortical tissue is highly sensitive to AMPA receptors and therefore is an interesting target in the treatment of epilepsy and prevention of disease progression. The efficacy of the drug is within 50% responder rate at a dosage of 18 milligrams and 12 milligrams. This is within 4 days after the first drug administration. Like most AEDs, Perampanel is associated with more drug interactions than any other drug class, and it is vital to understand the implications of a clinically relevant interaction and what outcomes need to be taken to avoid adverse outcomes. At clinically relevant concentration, Perampanel is neither a potent inhibitor nor an inducer of CYP-UGT isoenzymes, and is thus not expected to cause many drug interactions. However, it does have a few. These include a commonly used drug, benzodiazepines, which may increase the central nervous system depressant activities of the 1,2-benzodiazepine. Perampanel is most suggested to be taken orally once daily in the evening. The medication should be stored between 20 to 25 degrees and should be administered within 3 months of opening the bottle. Some common side effects of Perampanel include headaches, anxiety, irritability, problems with coordination, along with weight gain, stomach upset, nausea, and vomiting. Perampanel can also make you unsteady while walking or have problems with balance. This suggests that the medicine is a high falls risk, and especially in elderly patients. What to watch out for? Perampanel has serious adverse effects. These include aggression, hostility, anger, homicidal ideation, along with suicidal ideation and behavior. Patients and caregivers should contact health providers if such symptoms present. Patients should be closely monitored during the first titration period or an increase to a higher dose. As health professionals, it is our duty to advise the patient along with the caregivers of the black box warning that states the serious effects of the drugs to ensure a safe and well-advised treatment plan for the patient. Perampanel is a Schedule 4 prescription-only medication, meaning that a prescription is required in order to obtain the medication and can only be bought from a licensed pharmacy. Those that can prescribe the medication include doctors and nurse practitioners. The effectiveness of the drug is dependent on dosage and may vary from each individual. It is essential for patients to discuss with health professionals to build a suitable medication plan.